Women's Night. My name's Lorraine. I'm going to be your nurse today. Can I please just have your first and last name and your date of birth to verify? My name's Charlene Knight, 8/8/1939, and your allergies? Latex, penicillin, and betadine. Okay, perfect. It matches your wristband and also your provider's orders. So it looks like, according to your chart, you're having some trouble urinating. You haven't been able to go for 10 hours now, and you're just feeling uncomfortable. Is that correct? Yes, that's correct. I'm just going to put down your side rail here, okay? All right, so according to your provider's orders, they want to insert a Foley catheter. Have you ever had one before? Yes, I've had one. Okay, so as you know, it's a tube that will be inserted into your bladder, and it'll help you urinate. It's just going to drain the bladder of the urine. You won't have to get out of bed to do that, and it'll hopefully help relieve some of the discomfort you've been feeling, okay? Okay. All right, so I'm just going to put on some gloves and just assess you really quick, okay? Once I get my gloves on. Okay, so I'm just going to assess your bladder, just palpate your abdomen area here. Okay, it does feel distended, and I'm going to also check out your perineal area. I visualize the urethral meatus by pulling back the labia, and also at this point I would provide perineal care, wiping front to back, so that she's clean before I perform the catheter insertion. All right, I'm just going to leave you in this position. I have your supplies at the bedside. I'm just going to get everything prepared, okay? Okay, right. Perform hand hygiene. Okay. So I have my Foley catheter here. I'm just going to make sure it matches the provider's orders. It's for the correct patient, Charlene Knight, 8/8/1939. And the Foley catheter is to be inserted if the patient has urinary retention or is unable to urinate, which this patient's having trouble with, so it's appropriate. And I then inspect my Foley bag. There's no rips or tears in it, no moisture. I'd also make sure that it's not expired, which it's not. And then make sure that she's not allergic to any of the contents in the bag, which there's no latex, penicillin, or betadine, so that part's fine. I'm going to set my provider's orders to the side and perform hand hygiene again without turning my back to my package. Okay, now I'm ready to set up my sterile field. I'm going to open up the package, throw away the top part, and go ahead and take it out here. Okay. I'm going to keep this plastic bag as a trash bag and put it at the edge of her bed here to the cotton balls. Okay. Now I'm going to set up my field. I'm going to open the flap furthest away from me first, being careful not to cross over and only touching the 1-inch border. Then I'd open the left flap. Okay, and then the right flap, only touching the 1-inch border. And then I'd open the flap closest towards me. And then I'm just going to turn it to maximize my surface area here. Okay, so the way this was packaged, the glossy side actually isn't, there's no corner to grab from, but if it was folded, I would grab from the glossy side. So for the purposes of this, I'm going to grab from the corner and then step away, but I would grab from the glossy side. step away, have the glossy side face me, only touching the 1-inch border. Okay, and then I'm going to go over to the patient. All right, Miss Knight, I'm going to place this drape in front of you, okay? Making sure to not go below my waist. Not touching the patient's legs, okay? And now I'm going to put on my sterile gloves. Grab the package for sterile gloves. Let's go over here. Okay. Open the package. Make sure to crease it so it doesn't fold up on me. Okay, so I'm going to don my dominant hand first, touching the inside of the cuff here, because that part is not sterile. Step away. Slip it on. Okay, now I'm going to slip my fingers under the cuff of this glove. Being careful not to touch that part. Okay, step away. Once the sterile glove is on, I can readjust my fingers here. Sterile's touching sterile, so that's fine. Okay, almost got it. Okay. Okay. So I'm having some issues with the gloves, but it's okay. Okay, so now I'm going to remove the white drape. I'm not going to be using this, so I'm just going to drop that to the side. Next, I would open up the lubricant. Or I'm going to actually move this side here. Making sure it's within the 1-inch border. I would open up the lubricant. It's like twisted here. Don't want to reach over anything, so that's why I turned it. Okay, so I'm going to squeeze this into the corner here of my catheter box. Okay, and dispose of that. I'm going to carefully open my hydrogen peroxide and put that over the cotton balls here. Being careful to not have any spill onto the drape and contaminate it. Okay, dispose of that. Alright, so now I'm going to remove the sheath from the catheter here. Oops. That away. I'm going to place the catheter tip in the lubricant. Make sure that first couple inches are lubed for easy insertion. Okay. And now I'm going to attach the syringe, the 10 milliliters of sterile water. I'm going to take the cap off of that. Put that away. exercise the plunger. Okay, and I would go ahead and attach that to the port here on the catheter. Okay, so all my supplies are ready. I'm going to go to the bedside now. Alright, Miss Knight, I'm just going to place this on the edge here, within the 1-inch border. Okay, so I'm now going to contaminate my non-dominant hand to open her labia and expose the urethral meatus. I'm going to take the forceps to clean the labia. I'm going to begin with the fold furthest away from me first. When I'm done, bringing it around, putting it in the trash bag, making sure not to cross over my sterile field once I've wiped her. Clean the fold closest towards me, and then the one straight down the middle. Okay. And repeat. Furthest away. Closest towards me. And then the last cotton ball straight down the middle, not touching her legs, not crossing over the sterile field. Okay. Remove this part. Okay, now I'm going to go ahead and insert the catheter. It's looped up. I'm going to hold it 2 to 4 inches from the tip. Okay, Miss Knight, I need you to bear down. I'm going to be inserting the catheter now, okay? Right, being careful not to touch the labia and going only into the urethral meatus. Not touching the labia with my dominant hand. And I would advance it until I see urine. Okay, I see urine. I'm going to advance it 1 more inch. And then stabilize it with my non-dominant hand. And go ahead and insert the 10 milliliters of sterile water to inflate the balloon. And the manufacturer did not require it to be pre-inflated, so I didn't have to do that beforehand. If she felt pain, it would mean that it was in the urethra, but it inflated fine and she didn't feel pain, so it's in the bladder. Now I can release, disconnect. Okay, pull back until I feel resistance. So it's in the bladder. Then I'm done being sterile, so I can now attach the catheter at the bifurcation at her inner thigh here. And then I would take the catheter bag and attach it at an immovable portion of the bed, such as the bed frame. Down here somewhere. Making sure it doesn't touch the floor. Okay, so I'm done with the procedure. I'd make sure she tolerated it well. How did you feel, Miss Knight? I felt fine. I'd go ahead and make sure she's comfortable. Pull her gown down, bring the side rail back up, clean up my supplies, take my gloves off, and I would monitor her input and output every shift, and also provide catheter care at least every 8 hours or whenever she has a bowel movement. And I would then document the procedure.